And we are back on Saturday mornings on WHP 580. I'm Michael Parks, and thank you very much for staying with us here on WHP 580. We are taking care of business, taking care of our local businesses, learning about them, spotlighting them, learning about the products and services that they offer, and it is our mission on Saturday mornings to help promote our local businesses, because these are the folks who provide you with the best service and value. And also, they're your friends and neighbors. They hire your friends and neighbors. Their kids go to your schools, they go to your churches, and by promoting our local businesses, you're helping to promote our entire economy, and nowhere, again, will you get better service or value than with a locally run business. Well, everybody's had pains. It hasn't been a bad winter, but it's still been a long, cold winter. And if you have aches and pains or injured on the job, maybe out there on the ski slopes, or maybe in the gym, these are the guys who are there to help heal you, help you feel better, and help get you back on the court, back on the golf course, and back to work. It's our good friends at CPRS Physical Therapy, and it's a pleasure to welcome back our friend Jeff Shields, and also our special guest today, who is Andrew Strittmatter. And today we're going to be talking about shoulder problems, whether you did something on the golf course, or even if you have like a little leaguer, especially if you have a little leaguer. We got a special guest coming up whose son had some work done at CPRS Physical Therapy with Andrew. So we're getting ready for all that and much more. So, Jeff, good to see you again, buddy.
Thanks, Michael. Thanks a lot for having us here again today.
For some of the folks who are not familiar with CPRS Physical Therapy, just give us a little taste in who you guys are and what you do.
Well, Michael, we're actually celebrating 30 years of service.
Wow.
And you say about locally owned, local hired. We're very, very honored to have Rick and Vicki Tribbett, both local individuals that started this company and had a vision 30 years ago to provide these services with integrity, commitment, and teamwork. And that's what we've been able to do with 25 locations throughout the central Pennsylvania area.
Wow. And you guys have a great new webpage right now. That thing got unveiled just recently? Wow.
Absolutely. Just launched last Friday. Cool. And you know where to send everybody. But it has been launched as of last Friday. Did a real nice job. It's really 2 years in the making. We're real excited to have that out there for the public to log on to and be able to learn more about our company and our staff.
Exactly, and that webpage is cprsweb.com. And don't forget, they're on Facebook too. Just find them on Facebook. The staff and the crew and all the people have a lot of great information and great stories to tell as well. So like them on Facebook as well. All right. So let's get into it right now. Andrew Strittmatter, why don't you introduce Andrew for us?
Yeah, Michael, we're so excited today to have one of our really, truly brilliant young professionals here. You talk about being local. Well, Andrew is born and raised in the York area. He actually works in the York office for us. Mm-hmm. So it really goes to your business card. You talk about local professionals, local people. Yeah. Well, we brought one today. He's been published in a few articles. So real great professional here today.
Well, and that's one of the things that you didn't boast about because, at CPRS Physical Therapy, I'm telling you, it's like they are the best of the best and the youngest and the brightest, and it's just incredible, the people and the staff that they have there. So when you're going to CPRS Physical Therapy, folks, you are getting, these guys are really, really trained well. So Andrew, your forte and your specialty is about the shoulder. We always hear about the knee and the back. We sometimes don't get to hear too much about the shoulder. So it's a common area, though, for injury.
It is. The shoulder is the most mobile joint in the body. So it's a ball and a socket joint. Yeah. And you can picture a golf ball sitting on a tee. It's kind of a very mobile joint. It moves 180 degrees or more in many directions, and not many joints in the body do that, if any. And there's actually two joints that make up the shoulder, the ball and socket joint, and then the shoulder blade that sits on the back is called the scapulothoracic joint. And both joints need to work together properly for normal pain-free function. And a lot of times the shoulder blade is left out to dry and nobody really thinks about it during weight training routines, and it's a common area for weakness. The rotator cuff, because the shoulder is so mobile, the rotator cuff is a set of 4 muscles. It's very important to keep the shoulder stable. And the problem in the shoulder is that rotator cuff and a few other tissues go through a very small space and they're at risk for damage when you raise your arm up overhead. So that's the problem with the shoulder joint.
But it's not necessarily, you get a lot of athletes, and we always hear about rotator cuff and problems with athletes, more specifically pitchers. But, you run into patients and people who are just everyday folks doing the everyday things. They have shoulder and rotator cuff problems.
Absolutely. Whether it's work activities, working around the house, straining the shoulder. The other thing about the shoulder is that you can produce a lot of force with it. And because it's such an unstable joint, you can develop problems even with regular everyday activities.
So does it get worse as you get older?
Typically, yes. The wear and tear can build up over the years, and you can develop more serious problems. Usually the younger generation, younger athletes tend to heal up quicker and they have less severe problems. But as you get older, that turns into usually more significant problems.
Yeah, he's looking at me and you, Jeff. It's like, honestly,
I fall into that category, Michael.
When we talk about athletes, and again, when we hear about shoulder injuries, we usually hear about baseball pitchers, but a lot of athletes have problems with shoulder problems. Tell us about who they are.
Yep, the overhead athletes, anybody who's throwing, baseball, softball players, and swimmers as well. They use their shoulders overhead thousands of times every practice, doing the freestyle stroke and the butterfly backstroke. And then there's also traumatic injuries with contact sports like football and wrestling, where the shoulder's put into extreme positions. But the throwers commonly develop shoulder pain due to the repetitive nature of being overhead, as well as the force with which they use their shoulders. And the overhead motion results in wear and tear when combined with any weaknesses of any muscles in the shoulder, motion limitations, and other things like that. And they can develop what's called shoulder impingement. And what that is a wear and tear, pinching of those tendons from the rotator cuff and other tissues. And it's a domino effect. Once there's a little bit of irritation, swelling happens. There's not a lot of room for error in the shoulder. So once that happens, they become pinched even more often as well.
Can you actually try to prevent something like that? Is there such a thing as, they always tell you about stretching and everything? Can athletes help prepare their shoulder and avoid shoulder injury?
Absolutely. That's where the physical therapy aspect of it comes in, because it's not you can't prescribe something for every person in general.
Right.
It's an individually based program, and it's based on their impairments, whether that's strengthening, whether it's motion limitations, even stability of the shoulder. That's something that doesn't get a whole lot of focus all the time. But the muscles not only need to be strong, but they also need to work, when the proper time is. When they're using the arm overhead, the rotator cuff muscles and the muscles in the back also need to be strong and work when they need to. And that's important as well.
We're speaking with Andrew Strittmatter and also Jeff Shields from CPRS Physical Therapy. Learn about them at cprsweb.com. Andrew is based out of the East York office down there in York County. We were talking, Jeff basically talked about some of the papers and the studies that you have done. You're a part of a research study investigating shoulder injuries in swimmers. What were the results of that study?
I was lucky enough a few years ago when I was in graduate school at Arcadia University in physical therapy program there to help collect and compile data for a study that looked at swimmers, over 200 competitive swimmers, all the way from age 8 to age 77. And basically what we were looking at was what are the aspects of the swimmers that make them more susceptible to shoulder pain and disability. There's some swimmers that have pain and some swimmers that don't. So what were the differences there? And we found out that the greater exposure to swimming, previous traumatic injuries, any feelings of instability in the shoulder, and less participation in other sports were the most common things across the age groups that resulted in, or that were more correlated with shoulder pain.
Right.
23% of all the high school swimmers reported that they had shoulder pain, and 21% of those aged 8 to 11 also reported they had shoulder pain.
Wow.
And these high school swimmers are practicing for 16 hours a week, and many of them over 600 hours a year. Which is, about an hour and a half or more a day.
Yeah.
So the constant exposure to that overhead activity, and a lot of these athletes are doing the sport all year round.
Right.
That's what we showed by not participating in other sports as well. They're focused on one thing. The repetitive nature of that activity, can result in some of these shoulder problems.
Yeah.
So the hope of the research was that we could develop a injury prevention program and sometime in the future, or someone can develop it based on this data help prevent these injuries.
Well, unlike old geezers like me and Jeff, who whine about every little pain that we have, and we're always coming in there bugging you. A lot of the younger guys and the kids, especially in high school and stuff like that, they just, attribute it like saying, okay, I'll tough it out. So when should an athlete go to a physical therapist for like shoulder problems?
Any pain other than the usual muscle soreness. So I was a pitcher in high school. I know what it feels like after the day after you pitch in a game, or the day after you do all that work in the backyard. You're going to be sore, and that's typical for 1 to 2 days after you do an activity like that. But any of that pain that's not the usual muscle soreness that persists for a week or two, it's not going away. You don't want to let it go for months. I have a patient that let it go for 10 years. At that point, it's very hard to come back from that. She's getting better, but it takes more time. And that's also where direct access comes in for physical therapy. That means you can go see a physical therapist without a referral from a physician.
Yes.
And the physical therapists are trained to know when you need to go see the doctor, when you need further testing. So it's safe to go see a physical therapist if you think you have one of these problems.
Andrew, we were talking about some of the injuries that occur, especially when it happens to young athletes. You had a unique case, and in fact, we have the father on the phone with us right now, Mark Schimmel, the father, and his son Colby, who's a pitcher now in high school in York. He had some problems with his shoulder playing Little League, right? So tell us what happened with Colby.
Colby had what's called Little League shoulder. Little League shoulder is a growth plate fracture of the humerus, which is the long bone of the upper arm. And the growth plate is an area of the bone that's not yet calcified or hardened in young people. So they're still growing. And what happened was when he was pitching, he was thrown at such a high force that the shear force at the shoulder caused the growth plate to fracture. And the reason that the growth plate fractured was that some of the muscles weren't developed and weren't strengthened enough. He was growing so fast that they weren't able to keep the shoulder stable.
Okay. And then this not only happened once, but he was out for a while. Doctor said rest it, came back, and it happened again.
Yeah, he had the same issue that happened again, second time.
All right, and Mark Schimmel is on the phone with us right now. And Mark, you were a previous patient at CPRS Physical Therapy. You had an Achilles problem, right?
Yes, my Achilles tendon tore, and I came there for rehab, yes.
Yeah, and then after you were healed and then you started having these problems with your son, then why did you bring him to CPRS?
Because my Achilles tore about 4 years ago, and I'm still playing some ball now. So it's just a good job with me. That's what it's about.
Well, Mark, it's like Colby must be throwing hard. I mean, is he a fastball pitcher or what?
He's big for his age, so he throws pretty hard. So.
And that's probably the reason, like Andrew was saying, why he does it. Now, obviously, you brought him to CPRS. So what were some of the things that CPRS is doing for him?
They were doing some arm bands with him, arm strengthening, getting his shoulder strengthened up good, icing it, making sure everything was ready to go. And then they gave us a workout plan we had to do at home in the evenings.
Yeah, that's a great idea because that's what they do at CPRS, because they give you something to work with. Now, Andrew, this is what it comes down to. When I was asking you before, saying what can some of these athletes do, ahead of time, and actually come to CPRS. So some of the things you did for Colby, like you said, how did you and the staff help him out?
Well, the great thing about physical therapy, it's not just about what they do when they're at the clinic. It's about what they do at home and what they do afterwards. So I want to give the patients guidance or the athletes for when and how to return to their sport. They're not there just to get better and stop.
Yeah.
They're there to keep going, and then also advice for a future preseason training program. So Colby can keep doing the same things to get ready for next season.
Yeah. Now, Mark, it was like Jeff Shields and I were talking about this when we were younger. We just played ball like from April through August, and that was pretty much it. But Colby, with all the extra work that they have, is this pretty much like a year-round thing with him?
We always had like 2 months off in the summer. I mean, in the winter, like in the end of. Usually November and December he took time off. With the travel ball, they usually start up in January. So he really only got 2 months off. So I've been teaching my younger boys and kids on my younger teams to take off at least 3 months, maybe even 4 in the winter.
Yeah. So you got to go get our son. He's athletic and everything, but has he adapted to this project now? Does he realize that he has to do this so he can maintain longevity?
Oh yeah, yep. He's stronger now than he was before.
Oh, that's great. That's great. And I don't think Dad's not going to stop him from relaxing and everything. So he was a little league. This was a little league problem, and now how's he doing?
Well, he's playing varsity baseball for Eastern right now as a 9th grader. So it's telling me his arm came back.
Wow.
And the problem with it is he throws right-handed, hits left-handed, so it was even bothering his swing.
Yeah.
Because of the weakness in his shoulder.
Yeah.
So.
Well, and I think you mentioned briefly. So you do coach some other kids as well, right?
Yeah, I run a youth baseball program here. The problem is this: when your kids play for different teams, you've got to watch how many pitches they throw with each team, not just one team at a time. All three got to be combined, or 2, or whatever they're playing.
Yeah, but you're a firm believer, and I don't know how old you are, but probably back in the day when you were playing ball, you didn't have like many of these injuries, but it's a total different ball game right now, pun intended, is that, you're going to have to start taking care of your shoulder, your legs, and everything else like that. So this program that CPRS put together for your son, it's a pretty good thing, isn't it?
Yes, it is. Yep.
Yeah. Yeah. All right, Mark. Well, we really appreciate you joining us today, and all the best to your son. And we're glad that he's back on the mound and taking care of himself, because this is a long haul, right? This isn't just for a couple of years. He's got to stay healthy. Yep,
that's right. Yep. And I want to thank Andrew again for all the work he did. And I stopped in a few times and even talked to him after we were done going there. And he helped me out. Appreciate it.
All right. Okay. Well, take care and stay loose and everything. And we appreciate you joining us today.
Okay. Thank you.
All right, that was Mark Schimmel, and also joining us today, Andrew Strittmatter and Jeff Shields. We are with CPRS Physical Therapy, and today we're talking about the shoulder. We're talking about shoulder injuries, how you can avoid shoulder injuries, and especially if you're young athlete, say like Colby Schimmel, who's a pitcher, swimmer, football player, any athlete, how you can avoid the shoulder injuries and take care of your shoulder and heal. We're going to talk more about what else we can do for you and your shoulder, and what CPRS Physical Therapy can do for you. Learn more about them on their website at cprsweb.com. Also check them out on Facebook. And of course, you can hear this entire interview again. Find out all the contact information by going to WHP580.com. Click on air and go to Michael Parks. We'll continue in a bit. We are taking care of business on Saturday mornings on WHP. Taking care of business on Saturday mornings on WHP 580. Michael Parks along with Jeff Shields and also Andrew Strittmatter from CPRS Physical Therapy. And today we're talking about shoulder problems. All right, as we wrap things up today, Andrew, again, shoulder could be a big problem for a lot of people.
Yeah, it's the most mobile joint in the body. There's a lot of muscles that need to work together to keep it strong. And there's a lot of ways that it can become injured, overhead activities and anything sports to your home, doing work at your house.
Yeah, exactly. Working around in the house, or else a lot of those guys who work in the factories lifting up and moving stuff around. Athletes that are most susceptible. We had Colby on. He's a pitcher, but it could affect a lot of other athletes.
Absolutely. Baseball players, softball players, swimmers, anybody using their shoulder overhead, and even football players and wrestlers with the traumatic injuries they can get. Okay.
What can we possibly do to help out our area athletes?
Well, the first step would be if you think you're having problems, find your local CPRS office and get a free athletic screening. So you can set up an appointment and just go on our website at cprsweb.com and find the closest location. Give us a call. We'll set up a free screen to see if physical therapy is something that could help you, or if not, send you to the right direction.
Well, that's cool. That's really important. That's something we didn't talk about before. Is this something new, Jeff?
No, it's something that we've had.
Wow.
And it's sort of related to direct access, but it certainly comes into this realm with certainly with the overhead athletes and all those baseball players, softball players out there. That it is a free service, and our clinicians are really good at the athletics.
Does it just cover the shoulder though?
No, you can for anything.
Yeah, like I was telling you about my friend with the kid with his knee and ankle and stuff like that. That'd back in.
Perfect. Come in, do a screen, and we can let them know if physical therapy would be indicated for that particular that student athlete. And if we feel it needs to be referred out, we'll send it out to their physician or or whatever needs to be done for that for the service.
All right, and quickly, direct access. That's something that we still want to promote. If you have shoulder pain and stuff like that, you don't necessarily need to go to your PCP or your family doctor.
No, physical therapists are trained to do a screening to see if physical therapy would be right for you. You can go to the physical therapist first. We'll send you to the doctor if you need to go there. If not, we'll start treatment right away.
All right. Well, Andrew, again, it was a pleasure meeting you, and I hope that we'll sit down and talk again, because we can cover a lot of other areas right now, help out our area youth, and also, again, like the weekend warriors are out there who, are hitting the golf course or playing softball this summer, and, of course, all the people who are working hard, 40, 50 hours a week in the factories and everything else like that, dealing with that shoulder pain, and for even like old geezers like us, right, Jeff? It's good. Technology is good. We're good to have like young bucks like this coming in or helping us out.
Absolutely.
Hey, thanks for having me.
All right. Andrew Strittmatter, Jeff Schiltz, CPRS Physical Therapy, their website, cprsweb.com. Their great new website. Find out all the locations. You can also check Andrew out. Just go to the locations at East York. You'll see his page there as well. And, of course, look for them on Facebook. They got a lot of great information, a lot of reports, and a lot of updates and news there as well. Go to our website, hear this interview again, get all the contact information, WHP580.com. Click on Air, then Michael Parks. That'll do it for us for this week. Stick around. Medical Matters is coming up next, followed by the Plant Doctor, and I will talk with you next Saturday morning at 7. I'm Michael Parks, and we are taking care of business on WHP Talk Radio 580.